Good morning, guys. We have made it to the hospital, and she's down in my gown, and they are hooking me up to some vitals. Get me ready for surgery.
This one's gonna go on your side down here.
Okay.
You want to hit the discharge and make sure the monitor's on. I typically like to start with that just so that it, you have a view.
So we have my husband over here just being patiently. He is trying to download the app and get it ready so that he can get updates on me.
Get it. Where you at today?
Yeah.
Oh, that's
Oh.
Yeah, I probably didn't do that right.
Oh no, you're good. It just likes to fall around, you know, it works.
I got everything. I skipped.
Can we lift this up a little bit for me?
Oh, that's fine. As long as you don't want to add
Yes,
anyone or
ma'am.
anything.
There we go. Much better. All right, y'all.
start
So-
getting these put on your legs here.
Okay.
Little compression, so I'll start to give you massages. So
Okay.
when you come out of surgery, you don't get any like blood clots or
Okay,
anything.
then show a
Yes,
couple more
ma'am.
prompts there.
Okay. That's it. Connected.
You hit continue.
Well, now, so she's gonna be putting things on my legs down here,
Okay, so that's going to be kind
so
of like your
that
main
after
screen there.
surgery,
Okay.
there's no blood clots. It will help prevent
We're just
them.
going to send a practice message
And these
in
right here,
forwards.
they're gonna pump. That's what they'll do. They'll go like this on your legs, back and forth every so often.
Can you get that? Pops up.
Let's see, put them on.
There you go. And then you have kind of one of the little emotes there. Perfect. And then that's your timer. That's how long you can do it. Simple as that. If you need to get out of the app, that's fine too.
Well, you get double whatever you take.
Third leg compression.
Yeah, I only got one. But I
You
had,
have like a leg surgery?
I did. I had
Yeah.
right here. I had. They only put one of those on me.
Right. Typically, they just do the non-affected leg because they keep moving the other one.
Right.
Just kind of get in the way of them.
All right, now we have that done. That's hooked up. We're still waiting on the IV. Haven't got that far yet, but we're getting there.
I'm gonna have to do a little poke on your finger here for your blood
Okay.
sugar.
Okay.
Do you care which finger I use?
No, ma'am. Try not to. Disclaimer: if you don't like poking or blood, don't watch.
Put gloves on before you do anything. Yep.
That's one thing they taught me in the military. Put gloves on and then change them out every so often.
Yep. What branch were you in?
Air Force Auxiliary.
Oh, sure.
My dad was Navy, and that's why I wear this hat. And then great uncle was Marine.
Very nice.
And
A little bit of heritage then.
1, 2, 3,
Yes.
poke.
3 relatives were in the Army.
Yes.
2 were on my. It's my brother-in-law's family side. His dad
And
and
if you just
brother
wanna hold
were
pressure on
was
that for
forces.
me.
Nice.
And
All right,
my
y'all.
brother-in-law was Air Force.
Cool.
106 for your
Did I
blood.
say great?
106. It's a little high, but not bad.
Not too bad.
I try to honor all the branches of the military.
Sure. That's awesome.
Every time I see a veteran, I gotta thank my brother's service.
Gotcha. You're good. You can continue.
Hi, my name's Crystal. I'll be getting you ready.
Crystal and Crystal.
Oh, 106.
Perfect.
2 crystals.
Yeah, we got a lot of name Dukes around here.
I know
There was
doctor.
a guy in the waiting room. His name was Jonathan. I heard him call his name off, and I was like,
There are Dr. Bells that work here, and I'm like, I can claim myself as a doctor since I have the last name. Nobody would know.
yeah, my last visit I had here, he was like, I'm the doctor. I'm Dr. Felt. Or he'll wear his Avera shirt, and they'll be like, do you work here? You got to be careful.
I took like a few medical classes when I was in the service because we have to.
All right, y'all. Now it is a waiting game. My actual procedure time is 11:30, and it just depends on how they roll with the patients before me on what time I'll actually get back there. It could be a little before, it could be a little after.
Can I put this in?
Mm-hmm.
While she's doing that, I'll grab a temp from you.
I should be quiet so they can concentrate.
Oh, you're all right.
Really good blood pressure on you.
They're professionals. They're trained for this, aren't you guys?
Something like that. I don't know if we can call ourselves professionals.
Y'all are professionals. I say it.
There you go.
One thing I didn't get to do when I was in the service is we were supposed to, but I didn't. We were called on.
I can't get ice chips or anything like that, can I? From my
I
mouth
was
being
supposed to
dry.
take CPR class, but I passed my emergency services. And, it was kind of
Nice. Yeah, typically they don't like you having that kind of stuff before the procedure.
Yeah, that's what I was thinking that they would, but my mouth is so daggone dry, it's sticking together.
Yeah, it's never fun.
Take this in. And you're still bleeding? Maybe? No, looks like you're good.
Call light already?
I have a question. That guy's
What was my
got
blood
that
pressure?
thing on his foot.
Mm-hmm.
What happened to his foot?
Oh, I haven't been over there. I guess I don't know.
Alright, and then
What
this,
was my blood
It looks
pressure?
like there's a cast
looks like
underneath.
it's 146 over
Or like
87,
a-
so pretty good.
metal
And then red button if you need
Because
anything.
it's
Okay. Thank
Maybe
you.
the
Should be everything
might have
from
broke like a
us.
tip kind of
yeah,
thing.
just let us know if you
Separated
need
the two
anything.
bones.
All right, thank you.
Thank you.
I was just curious because I've seen it
Yeah.
all wrapped up.
Need anything? let
Thank
us know,
you,
man.
guys.
You're welcome. There you go.
Well, guys, I have had my blood sugar done. They got me hooked up to the compression things today. We have my compression socks
We got the
on.
same name.
I know it. We're
I spelled mine with a- I
Twinkies.
spelled mine with a K.
Oh, really?
Yeah.
Is it like KRYSTL?
Yeah.
Okay, that's cool. Because some people spell there. You wouldn't think there's so many different ways for people to spell crystal, but there really is.
Yeah, I heard them saying your name and I was like,
Yeah.
Hey, can you tell me your name and date of birth?
Crystal Davis, 10/31/86.
Perfect. And can you tell me what you're having done today?
Gastric bypass.
And who do you got here with you today?
My husband, Jonathan. And do you have a problem with recording?
No, sorry.
Okay.
Thank you for asking.
You're welcome.
And Jonathan, what's your cell phone number?
Hey guys, I have a Twinkie. My nurse here, I'm not gonna show too much, but real quick, she inputting all my information.
531-347.
Again, I'm gonna throw up a disclaimer for anybody watching. If they let me record all the way through up to the procedure, to after the procedure, I will have all the footage.
Do you have anything implanted at all? Any metal?
No metal, I don't believe, but I do have a coil and something else by my brain for an aneurysm.
Okay.
Yeah.
And do you want to leave this person in?
Yeah, I need a form to sign for this one and for that one, but everything else I've taken out.
Tape and cover it too.
Okay. Yeah, that's fine.
Any medication patches on currently?
I have on the nausea patch behind my ear.
Perfect. Left side?
Yes.
Any open areas in your skin at all?
No, ma'am. I think I had a pimple that I popped right here that may be a little sore or something. But other than that, I don't think so.
Do you wear a CPAP or anything like that?
I do.
I think she means more like a.
Are you a diabetic? Do you check your blood sugar at home?
I do periodically because I'm a pre-diabetic. Like sometimes
Okay.
it'll be high, but I'm not just a full-blown diabetic.
Okay.
So,
Getting around, you don't need any assistive devices?
devices, no assistance. Yes, I'm legally blind.
Okay.
So I did, he aids me with that most of the time, but
Legally blind?
Yeah.
So can't see?
not like what you can. No, ma'am. Not. I can see shadows and things like that and stuff. If you get close enough to me, I can see you really well.
Okay. Have they given you glasses?
But they don't work.
Don't work, yeah. No hearing aids, no dentures?
I do wear hearing aids, but I do not have them with me.
Okay.
She doesn't wear them at all.
You're not supposed to tell on me.
When's the last time you had a problem?
Yes, yesterday, last night. Snitch.
Gotta be honest, yeah.
Did you take any medication this morning?
I took the gabapentin. I think it was 300 milligrams. Whatever it was that they had sent home with me, it should show up there. But they told me to take it before I
Okay, just the
come this morning.
gabapentin. And what time did you take that?
Oh, about 5.
And is that the last time you drank anything?
No, she told me I could drink up to the time I got here, so I had some water on my way before the 9:30.
Okay, so like 9?
Yeah.
Okay. When's the last time you had anything to eat?
Oh, I had some broth last night. Are you talking about whole food or would that count?
Whole food.
Probably about 10:30 yesterday morning.
Do you have all your other jewelry off besides?
What time do you have on your watch?
9:28 on both.
Allergies, it's duloxetine and montelukast.
Uh-huh.
Go to your home meds here quick. Looks like you last took your vitamin C on the 1st.
Yes.
Looks like pretty much all your vitamins.
Right.
On the 1st. Okay.
Mm-hmm.
The first was my birthday.
Oh, happy late birthday.
Thank you.
He turned a whole 73.
Oh.
He likes to tell everybody that. He'll flip his age over. He turned 37.
Have you took your cyclobenzaprine recently?
No.
Okay. Looks like you take this. I'm not gonna pronounce it right, but it's your amphetamine.
Yep, I took that yesterday.
What time yesterday?
Probably about 5.
In the morning.
Uh-huh. Yeah, I get up and go to the gym every morning, so that's when I go to the gym, so I'll take all my medicine around that time.
What about your fans?
Famotidine, probably about 5 that morning and then about 7 that night for the second dose.
Your Loratadine? Your allergies?
Loratadine, about 5 that morning.
Multivitamin was the first.
Mm-hmm.
Looks like Olanzapine. It's for bipolar and mood. Do you still take that?
I do. At nighttime, though, so 7.
Okay. Did you take it last night?
Yes.
Protonic, did you take that yesterday?
No, I haven't taken those in about 4 days as well, so I said the first.
Okay.
I was told that's one that y'all would want me to stop prior to surgery.
What about your potassium chloride?
Every day. I take it at 5 in the morning as well.
So you took it yesterday?
Mm-hmm.
Your Lyrica?
Yesterday, twice a day.
So at 7 again last night?
Uh-huh.
Skull patch, you put it on last night?
Yeah, I put it on about 8, a little after 8.
Ceridolene for mood?
Uh-huh, in the morning at 5 and then at night at 7. And I did take it yesterday as well.
Perfect. Okay, anything else that am important that I'm missing?
No, ma'am.
Perfect.
Oh, you didn't say the bumethidine, which is a fluid pill.
Okay,
Or
yeah.
bumethidine, however you want to say it.
Did you take that yesterday night?
Yesterday morning.
Yesterday morning?
Mm-hmm.
Pharmacy is set for here at McKinnon?
I
You said?
did. Yes, ma'am.
They used to have e-pharmacy.
No, I had them set it for here because they can give me bedside medication while I'm
Yeah, they
here.
can deliver it.
Versus it being all the way there, I'd have to wait until I got home to get it. And as far as my actual home pharmacy, it would be Hy-Vee. But for my stay here, I done it at McKinnon.
And today, we're going to check your electrolytes, your hemoglobin, and your blood type.
Uh-huh.
I'll get your IV started and all that, then I'll go grab another form for the
Okay.
jury, and then I'll do everything all at once.
Could we figure out what my blood type is?
I will also throw out another disclaimer. I'm just
We
supposed to
can't
do
do
my
that here,
IV.
no, you'd have to ask your primary.
Oh, okay.
Okay, this is going to need to take this one. Are you a hard Coke?
No, I wouldn't say so. Just depends on where you go.
Where do they usually go?
Usually they'll go like on the back of my arm or around here in the front down at the
My
bottom.
hand?
Try not to put your face on there too much.
Sometimes when you're
If you need to go there, you can go there too.
Can I have you pop your hand a couple times for me? Right, get a little vein finder. Can I look at that arm too quick?
Uh-huh.
I just want to get it in the
Alright, yeah.
shot.
You want me to pump it for a minute?
Yeah.
You can tell I haven't taken my fluid pill. I am puffy.
Yeah. Sometimes that makes it harder to.
Yeah.
I was gonna be back. It's vein finder is what we call it. It's like a little
Oh,
scanner.
Yeah. I know what you're talking about. It's like kind of like a those black light things. That
Yep.
yeah. Yay.
That black lady with that little kid, she had the same color pants on that my shoes are.
I like the color of your shoes. Ain't they cute, y'all?
You like my shoes?
I like the color of them.
And you said no metal, correct?
No.
Where are you from?
I'm originally from Arkansas.
Okay, as I said, you have a little bit of an
Yeah.
accent.
Yeah, I moved here with him 2 years ago.
What made you move here?
He had lived down here previously and been down here for a while, and I just was so sick and tired of the South. And so I moved here, and I love it.
Yeah.
I got broke in really quick with the snow. My first year here was last year, where
Oh, yeah.
kind of was a bit of a rough winter. But other than that, though, I love it. Find
And
it
this
good when I'm
past
there.
winter was pretty mild.
Yeah, I was so
I don't know if you thought it was
disappointed.
mild.
I was like, oh no, that means we're gonna have a rough summer, because last summer wasn't a bad summer at all.
Yeah.
Like we had 2-3 days that I think we seen the high 100, but other than that, it was 80 all year, and I was like, yeah. So where I'm from, it's hot. It's, oh man. I like how you do that to go in and get it all at one time.
It's already kind of irritated to
Okay.
get it.
We're being hard-headed.
Yeah, that LASIK's not taking that fluid pill.
It has me
and
all
then-
blowed up. Like normally I don't swell that quick from taking it, but as I took it yesterday morning,
Yeah.
and I am swollen.
I got blood, but it stopped right away. Doing okay?
Mhm.
If it gets too much, just let me know.
Yeah, it's a couple hours from the city. It's probably 6.5 hours from here, nonstop. Usually it takes about 8 hours. Oh gosh, no. I guess I'm in that weird stage of life where it's like.
I must be very busy today.
Yeah, it is decently busy.
I hear newborn babies crying.
Yeah, we do all ages here. Well, it might be a little bit more difficult today because
It's fine. It's not too bad right now.
I think it went away. Shoot. And you can tell you get blood by this little right there,
Uh-huh.
but it's supposed to keep filling up and it just
It's,
stops. So it started filling up and then I
stopped.
Yeah. So
That's
I
like-
don't want to use that one.
Okay. Well, guys, I'm going to come back and record later. I'm going to let her get this IV so I'm not distracting her by my video. I will catch y'all later.